Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. In 2013, the American Medical Association recognized obesity as a disease which affects approximately 33% of the United States population. Scientific studies demonstrate some very strong genetic and environmental aspects that go along with the obesity. Well, some call it an epidemic. Our guest in studio today is returning to speak with us, Dr. Glenn Rich, endocrinologist, recently certified as a diplomat by the American Board of Obesity Medicine. And he's here today to talk with us about the financial aspect of living with and treating obesity. Welcome to Health Professional Radio, Dr. Rich.
Thank you so much, Neal.
When it comes to obesity, it's being called an epidemic. 33% of our population is affected by obesity. And then some of the other problems associated, hypertension, heart disease, sleep apnea, cirrhosis, even infertility, all associated with obesity. What are some of the costs associated with obesity above and beyond just the mental stress, and many folks are on antidepressants for some of the mental aspects of obesity?
As you mentioned, Neal, there's many diseases that obesity leads to, and you just named a handful of diseases, but things like cancer is probably the number one risk factor that's reversible in terms of for development of cancer. It develops arthritis. There's more days out of work for patients who are overweight. So it is a huge strain on the system, both in terms of the cost of treating somebody overweight exceeds that of treating a normal weight individual, and the unhealthy weight that the patients have come along with many of these other costs in terms of treatment that are required for the other diseases, yet alone just a treatment for weight management itself. Many of the drugs out there or the surgeries are often very expensive.
The American Medical Association recognized obesity as a disease. Now, did they recognize it as a disease in 2013, or did they recognize it as a disease in 2013 that affected so much of the population? Had it been considered a disease before that, or just something that didn't affect the population on such a large scale?
I think before 2013, while many people considered it a disease, it really did not have that designation. And many people at that point, there still was argument that this was more of a life choice rather than disease. Okay. And I think the scientific evidence has really come out so strongly that this is a medical condition, a medical disease like any other disease, that I think they were able to finally make that diagnosis as a medical illness or medical disease. And I think that will help in terms of getting insurers to pay for medications and pay for treatment, although it's still often a challenge. Workplace combinations that sometimes people will need in terms of larger chairs, larger desks, that many places don't offer, in terms of just everyday living. And it's with medications for the diseases, for treatment for all the complications, it does become a very financially burdensome proposition. Most medications, as you probably know these days, except for generic medications, are extraordinarily expensive, and many patients who have weight issues are on multiple medications for multiple diseases. So even if they have good insurance, the co-pays will add up for many of these patients.
Do you find that folks that are considered obese are coming into your practice and talking about some of the stressors associated with air travel or as you say, employment, things of that nature? How does the Weight Control Center there at Fairfax address some of these mental issues when the patients begin to speak of them?
Many patients do complain about many of their life struggles in terms of traveling places, in terms of sort of biases out there against people who are overweight. There's a huge problem, I think, with patients also being underemployed because I think even in the workplace, people tend not to get as good a job as someone else the same way would get. So there is this huge amount of sort of underemployment and biases against these patients. So I do speak with patients about what we can do. There are many societies out there that are working in terms of the Obesity Society and the Endocrine Society to try to decrease these type of biases for patients. There's some employers who will provide larger furniture, stuff like that, but that's not always the case right now. So it does make it more challenging for many of these patients to be able to do that.
I have noticed, not on a large scale, not myself. That's not to say that it doesn't exist, but changes being made in airline passenger accommodations, also in some taxi situations in some cities. There's been talk of widening the interiors to accommodate those customers and patrons who may be obese. And actually, some airlines are rumored, I'm not sure myself, but some I've heard are actually charging more based on weight, citing fuel costs and things of that nature. Is that anything that you have heard from some of your patients?
I have not heard that much from my patients, although just flying an airplane this weekend, an overweight individual was having to challenging to sit in one of the normal chairs that they have on the plane. So it does make it challenging, and there also are some employers who charge more cost for their own insurance stuff for patients who are above the ideal BMI. So there is stuff that makes it more expensive for many patients who have weight issues in terms of costs. I have not heard about the airlines charging more, though I would not
place it past
be surprised if they are.
Now, as we wrap up this segment, Dr. Rich, I'd like to ask you about some of the financial aspects associated with obesity when you're trying to maintain a household when you're not the only one who's considered obese. You mentioned in another segment genetic aspects, children being obese because the parents have been obese and the siblings are obese, even twins who are born or separated and raised in different environments genetically can be affected by obesity. What about trying to, maintain a household and reverse your own habits while trying to instill good eating habits on your family?
I agree. What I try to recommend and instill into my patients is sort of healthy life choices in terms of healthy eating, which means a lot more fresh foods and a lot more vegetables, which clearly are a lot more expensive than getting the processed foods in the supermarket. It's easy to cook. A lot of patients, in terms of time commitments, it's not easy for them to pick up an unhealthy, inexpensive meal rather than a more healthy food in terms of more, as I said, more what I propose a more Mediterranean sort of low-carb diet, and that tends to be a lot more expensive for individuals. Also, I think, as I mentioned, also medical costs and copays and stuff for these individuals are clearly higher than they are for families that don't have weight issues. So all those things do play into this, and this is a very challenging area. And as being new to the obesity field, so to speak, I have found this much more challenging, both in the medical part of it, in terms of the psychosocial part of it, and in terms of the financial part with patients than I found in any other field of medicine that I've done to date.
Now, let our listeners know where they can go and get more information about you, the Weight Control Center, and Fairfield County Medical Group.
Well, we're located in Trumbull, Connecticut, and right now in the process of redoing our website to get up-to-date information about our weight program on the website. So it should be up and running within a couple of weeks. And our website is www.fairfieldcountymedical.com. And there should, I said, in a couple of weeks, be a lot of information on our website for that.
All right. Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Glenn Rich, a board-certified endocrinologist, recently certified as a diplomat by the American Board of Obesity Medicine. And he's been in studio with us talking about some of the financial issues that are associated with living a lifestyle of obesity and in treating obesity. It's been great having you here with us today, Dr. Rich.
Well, thank you so much, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.